Hello and welcome to this month's video blog series from the Leadership Development Group. We are focusing today on leadership within the healthcare ecosystem, and it's my pleasure to be speaking today to Dr. David Carmouche. David is formerly the Chief Medical Officer and Senior Vice President of Operations at Blue Cross Blue Shield of Louisiana, and presently the President of Ochsner Health Network and Senior Vice President of Ochsner Health System in Louisiana. I'm very excited to have you here today, David.
Thanks for having me, Tracy.
Thank you. So to start off with, today in the healthcare industry, we recognize that in order for any one of us to have an impact on population or community health, we need to be working and thinking cross-sector, which means thinking from the payer, the provider, the pharmaceutical, and even policymakers' perspectives. From your perspective, what does it mean to lead with a healthcare ecosystem perspective?
Yeah, I think when you think about the problems in healthcare that face individual patients and consumers of healthcare services, their needs are so complex, and the solutions to those needs don't reside in any one sector. So I think leadership across the ecosystem means bringing together those sectors, having some working knowledge of each of the competencies and shortcomings of each sector, and being able to communicate effectively across those sectors to find really the right solutions to drive better healthcare experiences and better health for people who seek that in this country. You've
had a great career. You've worked within the payer community at a senior leadership level. You are now within a provider sector. Of course, you've had relationships across the pharma industry and no doubt have been impacted by policies. Tell me a little bit about what the challenges are in order for a leader such as yourself to have that perspective of an ecosystem.
Well, first of all, I feel blessed to have had experience in each of those sectors. I think it's unusual to find physician leaders who've actually been blessed with the opportunity to serve in all of those capacities, and I have, and that gives you a perspective that's relatively unique. But I think more than anything, what it just takes today to lead across the ecosystem is just a willingness to understand that you're going to be dealing with ambiguity. If you like certainty, if you like to know a clear path, then this is not really for you. I think that's where you start. Second, I think you have to be really patient but persistent. I think progress happens when you have a vision and can elaborate that vision and communicate that vision. But certainly along any journey, and healthcare is no different than any others, there's going to be times when you feel like you're just taking one step forward and two steps backwards. So I think being able to have a clear vision, staying optimistic and being patient and persistent is really what it takes to be successful.
Yeah, that's great. Wonderful leadership competencies, not only within your organization, but as you think about cross-sector as well. Could you provide an example for the viewers of our vlog today of how you have implemented a cross-sector collaboration to impact the health of a community?
Yeah, I think probably the best example of that was when I was at Blue Cross. I think looking at the people of Louisiana, for example, we're usually 49th or 50th in most health status. And there's a dearth of primary care services, and so Blue Cross was the dominant commercial payer and had the opportunity to really influence how primary care was going to be delivered and rewarded. And so we put together a program in collaboration with over 700 primary care groups across the state of Louisiana. A payer and providers actually coming together, leveraging both strengths to create this new program that really drove very substantial improvements in chronic disease management and rewarded providers differentially based on how they were able to manage those conditions. It gave them a lot of support tools, both data and technology infrastructure, but also some care coordination structures to allow them to be more successful. I think it's been a really, really good example of how two historically kind of adversarial sectors in healthcare actually came together to do something really great for the people of Louisiana.
David, from your experience, what steps can organizations take today to implement cross-sector collaborative partnerships?
Well, I think it just takes an understanding first that this type of leadership is really valuable, and there aren't folks out there, there aren't lots of folks who inherently necessarily have had the opportunity to lead across an ecosystem. So I think you have to create opportunities for people to learn. I think it starts by just designing working sessions across sectors and allowing leaders to participate. And really it starts with them listening and understanding and putting themselves in the shoes of a different sector, and then learning how to communicate with those people. And I think over time, the more you do that, the better you get at it. So I think these are competencies that can be cultivated, that need to be cultivated, but that pay really great dividends in the end.
Yeah, that's great. Thank you. Thank you so much, David. I sincerely appreciate you sitting down with us today for a few minutes and giving us some insights into your experience and background, and I'm sure that our viewers will very much appreciate learning from your experience. And to all of our viewers, I want to thank you very much. This is our last video blog for 2016. We look forward to having you join us in 2017 as we introduce a new webinar series. But until then, take care and happy holidays.